And so the combination of the Smilow Cancer Hospital and the Yale Cancer Center is really unparalleled in the country as a place for people who really want to make a difference in how we deal with this disease. And that becomes a huge issue in recruiting because people want to see themselves as making a difference. People who are scientists and people who are cancer doctors, they wake up in the morning and they ask, how can I make a difference? They go into this because of a burning passion to help people. And we want to try to create the culture that makes that happen. Well, I think it's very clear that in medicine, being treated by people who take care of one disease and do it well makes an enormous difference. And then even within that, being taken care of by teams of doctors is really the trend that will define cancer care over the next 20 years, where you don't just want to see a surgeon. You want to see a radiation oncologist, you want to see a medical oncologist, you want to have all the issues brought out before you begin therapy. And I think that's something that we've really worked hard on here at Yale. And so that's why we believe that bringing together teams of doctors to focus on an individual patient's cancer makes an enormous amount of sense. So the teams that we're bringing together aren't just clinical teams. They're teams that are tied to research efforts. We have 7 powerful research programs at the Yale Cancer Center, and these will expand as we move into West Campus. The opportunities in West Campus are absolutely extraordinary. Extraordinary in several ways. One, we have one of the country's very best genomic centers, and this is where we can look at the sequences of genes that allow us to tell why a certain cell is cancerous. And then the second thing is we're going to be able to bring scientists who can use that genomic information or that information about the genes in a patient's cancer to start looking at, are there ways we can change that biology? And the culture of West Campus is going to be absolutely extraordinary, bringing together chemical biologists, cancer biologists, tissue engineers in a really innovative new design. So I'd say tumor boards are the heart of multidisciplinary care. And so in a tumor board, you bring together a pathologist who examines the tumor tissue, a radiologist who reads the x-rays, a surgeon who can remove or cut out whatever the cancer might be, a radiation oncologist who is able to give radiation therapy, and a medical oncologist who does chemotherapy. All 5 of those, and in some tumor boards we even bring in other specialists who have a perspective on that cancer. And we talk about what the best way to treat or diagnose that patient may be. And it's better when you're struggling, it's better to do it as a group and to talk about what are the implications if we do surgery, what are the implications if we do radiation. And so I think that's a really important time for doctors to get together. You also want to create, when you're starting something and building from the ground up, as we did with Smilow Cancer Hospital and the Yale Cancer Center in West Campus. I hate to say this, but you also want to make something where people have fun, where they actually enjoy themselves, where they feel challenged, but they like each other, okay? It may sound relatively simple, but this job is so hard. Taking care of patients is incredibly stressful. There's so much pressure in terms of what people do that you want to like the people you're working with. And one of the things I'm trying to do from a leadership standpoint is create teams of doctors and scientists that like each other, that like coming to work together and enjoy the interaction. At Smilow, we have 12 outstanding disease programs. We're always working to make them better. You know, it's a little bit different than building the snow fort. And the problem is, once you finish building the snow fort, what were you going to do? You couldn't really live in the snow fort. There was really nothing to do with the snow fort, and then you kind of just ignored the snow fort and went on and had a snowball fight. Here, it's not just about building the snow fort, because the snow fort is dynamic, it's changing, it's moving, and that's one thing I think that makes working in a cancer center such an extraordinary opportunity, because our understanding of cancer changes, the treatments that we offer patients change, and it changes monthly. It's not something that you can build and say confidently, we're finished. We'll never be finished with this job. We'll never be finished until we find a way to conquer cancer. And I think that's one of the things that I appreciate about Smilow and Yale Cancer Center is that commitment to ongoing improvement and making this place better. So Smilow Cancer Hospital is known for bringing personalized medicine to patients, designing care around a given patient's individual cancer, both at a biologic level and at a treatment level, bringing teams of doctors and specialists together to treat cancer. It's also known for having the very best doctors and nurses. We have great doctors and nurses here at Smilow. It's also a place that's known for focusing on trying to cure cancers, trying to bring cures to patients, and doing that by pursuing research clinically in terms of clinical trials, but also in terms of science at West Campus. And those, I think, are the four things that Smilo is best known for. I think what makes Smilo particularly exciting as a place to be right now is the intersection between what we can do for patients and what we can offer scientifically. We have some of the world's very best scientists here at Yale. In fact, I think we have the world's best scientists here at Yale. And I think the chance to bring those scientists together with outstanding doctors and clinicians is something which is really unique and makes Smilo and Yale Cancer Center very special.